sponsored by Maryland Vascular Specialists.
In the U.S. alone, more than 18 million people have symptoms of PAD, which is Peripheral Arterial Disease. Now, today we're at Maryland Vascular Specialists to learn more about PAD and what you should do if you think you have symptoms. All right, now this is Natalie Fil, nurse practitioner, joining us today. So thank you so much, Natalie.
Welcome.
Okay, so talk to us about the conditions that you guys treat here at Maryland Vascular Specialists.
So here at Maryland Vascular Specialists, we treat peripheral vascular disease, and that can include diseases of the veins and the arteries.
Okay, and then PAD. What are some of the symptoms and then the risk factors?
So for peripheral arterial disease, or PAD, some of the symptoms that patients typically report are pain in the legs when they're walking, and this can decrease their walking distance. They may have non-healing wounds or ulcers on the legs or the feet, or pain in the toes when they lay in bed at night.
So how is PAD diagnosed and then treated?
So PAD is diagnosed by some simple non-invasive testing, something called an ankle brachial index, where we do a blood pressure in the arm and a blood pressure in the ankle, and that tells us if the blood flow to the toes is what it should be. If we need a little bit more detail, we do another non-invasive test, which is an ultrasound to actually look at the arteries and see if there are any blockages.
Okay, but what happens if it's left untreated?
So if PAD is left untreated, it can cause a diminished lifestyle. So you can't walk the way you'd like to walk because your legs hurt so bad. Therefore, you're more sedentary. If you have wounds or ulcerations to the feet, and you don't have enough blood flow going to the feet to heal those ulcerations, it can cause gangrene or tissue loss, amputation.
What makes MVS stand out from other treatment providers?
So with MVS, a lot of our interventions are done here in our outpatient centers, so patients don't have to go into the hospital. We assess the patient initially, determine if they need any testing. We complete the testing here in the office, and then if it's deemed necessary for them to have an intervention, we also do that here in our centers.
So that has to be a big plus and relief for the patients, right? How do they respond?
Patients seem really satisfied with that. They like that, everything can be done in one location. They're comfortable with the location. They learn, the staff, and I think they're very satisfied with that.
Is there anything that people can do to prevent PAD?
So we always recommend exercise, so the more you can walk, the better. Even if you are having symptoms, if you push through those symptoms, we always encourage that. If you are diabetic, trying to control your blood sugar as best you can. Quitting smoking if you do smoke, controlling your cholesterol and your blood pressure is also very important.
Okay, awesome information. Thank you so much for joining us today, Natalie. Now, if you want more information about Maryland Vascular Specialists, please visit mvsdoctors.com.